Hello, my name's Sophie and today I'm going to be talking about schizophrenia. So to start off with, there's just a few questions to see what you already know. So question 1, what is the lifetime risk of developing schizophrenia? Is it 1%, 5%, 10% or 0.5%? And just to clarify, the lifetime risk is how likely it is that a person will develop schizophrenia at any point in their life. The correct answer to that one is 1%. Moving on to the second question, what is the average age of onset of schizophrenia? Is it 13, 70, 25 or 40? And the answer to that one is 25. So 25 is the average onset, but it can be earlier in males, and it's even been known to affect those who are as young as 15. And the last question now, which of the following best reflects the sex ratio in schizophrenia? The disease is equally as likely to affect men as women, the incidence is higher in women, or the incidence is higher in men. The correct answer is that the incidence is higher in men. It's also more likely to affect men more severely, and males' recovery tends to be worse. Okay, so this is just going over what I'm going to cover today. So I'm going to cover what is schizophrenia, its symptoms and history, the investigations, and some OSCE tips. And it's just going to go over the questions again at the end to see what you've learned. So what is schizophrenia? So it's a psychotic disorder resulting in distortions of thinking and perception. It affects about 1% of the population and typically develops in the late teens to early 30s. It's more common in males and the onset is earlier in males. So the cause of schizophrenia is actually unknown, but it's believed to be a combination of different factors. So there's supposed to be a genetic predisposition that then, when there's an environmental trigger, can develop into schizophrenia. So as you can see in the genetics, a person who's a non-identical twin only has 15% chance of having schizophrenia if one twin does, but if they're identical, then if one twin has it, the other has 50% chance of getting it too. So you can see that it's higher in the twins that have the same genetics. And then there's also some theories that in pregnancy, if the mum has a viral infection, then it can increase the risk. And then also there's some brain abnormalities which are seen in schizophrenia. However, it's not known if that's the cause of schizophrenia or an effect of it. So these are enlarged ventricles, small amounts of grey matter, and they have smaller brains in general. And another important point to consider is that cannabis use as a teenager is also linked to developing schizophrenia later in life. And again, stressful life experiences. So there's a few different types of schizophrenia. So I think the one that most people think of when they hear schizophrenia is a paranoid schizophrenia. However, there's also a few different types as well, which you might see in a psychiatric hospital. I'll just leave them up so you can read them. Okay, now moving on to symptoms. So the positive symptoms are things that are added from normal behaviour, so the things that you would, in a normal person, you wouldn't see. And the negative symptoms are things that are taken away from normal behaviour, so things that you would expect to see that you don't in people who've got schizophrenia. So in the positive symptoms, you get hallucinations, delusions, disorders of thought, and thought disorganisation. And the negative symptoms, you get poor self-care, poverty of thought, social isolation, and some cognitive defects. So just to go over what some of these are, because some of them are like words that you wouldn't have heard before. So hallucinations are sensory experiences in the absence of any external physical stimulus. So although there is nothing causing the hallucination, that person experiences it as if it's a real sensory experience. A delusion is a fixed false belief that's not accepted by other members of the patient's culture. So believing something that no one else does. Thought blocking is where there's a sudden stop to the flow of thought in the middle of a sentence and then the person can't remember what they were talking about. Thought withdrawal is where the person feels like thoughts being taken out of the mind, and thought insertion is where they feel thoughts being inserted into the mind by someone else. Tangential thinking is where there's diversion of train of thought to like another and they never go back to the original point. It's just the conversation just changes topic. Flight or ideas is where they have really fast thinking and they have a lot of fast speech, which is not really related to different concepts. And catatonic behaviour is abnormal stupor, posturing and negativity. So if you think someone does have schizophrenia, these are the things that you do. So you'd want to do a midstream urine to rule out a UTI causing delirium, especially in an older person, as that's quite common. You want to do a urine drug screen to rule out any drug intoxication. If you can do a CT scan if you think there might be an organic neurological cause. So if you think they might have had a brain injury, for example. You can do syphilis serology. You can do a full physical examination, and you need to do bloods before starting any treatment, so you need to do quite a comprehensive set. So the clinical examination is quite difficult for schizophrenia because it's mainly based on just talking and like watching the patient. So the mental state exam shows you how to do this, and it goes through a few steps. So you start off with appearance, so you like how they're dressed, are they dressed well for the environment, the weather, etc. Then you look at the behaviour, so how are they acting with you, like do they form a rapport, are they looking at you, are they hostile towards you or too over friendly, and how are they cooperating with the conversation. The next one's speech, so is it of normal rate, tone and volume, and does it flow well to make a good point? As I mentioned before, some of the symptoms are that the speech can become quite disorganised in schizophrenia. And then you look at the mood, so the subjective mood is what they say they feel, so if you ask them, how would you feel, that's their subjective mood. And the objective mood is how you feel they feel, so do they look like they're sad, do they look like they're happy when they're speaking. Then you look at the thought, so you can ask different questions to see what they're thinking, so do they, like how do they think other people see them, do they think they have delusions, do they think that people are inserting or withdrawing thoughts from the head. Perception, so that's, although they might tell you that they can hear voices, like do they seem to be listening to them, do they respond to any voices or any hallucinations while they're talking to you. The cognition is how they concentrate or they're orientated, how the memory is, so just in general like how they're thinking and is that normal for them. And insight, so do they think they have a problem and do they think treatment's required. So this is something in schizophrenia that they often don't have, so they don't think there's a problem with them, they think there's a problem with other people, or that they think that things that are happening to them are real. So to diagnose schizophrenia after you've done the assessment, so the ICD-10 criteria is that you have to have at least 1 month of at least one of, so thought echo, thought broadcasting, thought withdrawal or thought insertion, so really any disorder of thought. Delusions of passivity, so feelers that their own thoughts and feelings are not their own. Delusional perception, so believing that a normal stimulus has special meaning for them. So that's like if they watch TV and they see, for example, Elvis Presley, and they think that Elvis Presley is talking to them, especially, not just to everyone. Hallucinatory voices, so that's if they can hear people discussing them, or they've got a running commentary, so everything that they do they can hear being described in the head. Or bizarre delusions, so they're delusions that are just completely inappropriate and impossible. Or you can have at least 2 of hallucinations in any form for every day for a month, accompanied by delusions, thought disorders leading to incoherent speech, catatonic behaviour or negative symptoms, so they're things like blunting of affect, poverty of thought, etc., and they can't be due to depression or medication. So them ones are less classical, so you need to have 2 to get the diagnosis. So what else could these symptoms be caused by? So there's schizoaffective disorder, which is where you've got kind of a combination between schizophrenia and depression. There's delusional disorders. Could be in a manic episode of bipolar disorder, which is causing you to act like that. It could be used secondary to psychoactive substance abuse, so if they're intoxicated by drugs at the time you're doing the assessment. In some cases it could be due to dementia, could be due to delirium or personality disorders. And one that's on there is also severe depression can sometimes present with psychosis. So a few OSCE tips. So people who are schizophrenia are not likely to have insight into the condition, so they'll not tell you, because they think it's real, they'll not tell you like something as a symptom, it'll just be you'll have to ask about it. So some useful questions for hallucinations are, do you ever hear voices or voices when there's no one else there? Do you recognise the voices? Do they tend to comment what you're doing, for example? Do you ever respond to the voices? So for thoughts, do you feel able to speak clearly? Is anyone taking thoughts out of your head, or your thoughts your own? Can anyone else hear your thoughts? Delusions, Do you ever feel that somebody is paying attention to you and what you are doing? When you watch TV, do you feel the story is related to you? And passivity, do you ever feel as though you're being controlled by someone else? So if the answer to any of them questions were yes, then you'd be more likely to suspect schizophrenia. Okay, so just going over this summary. So this is the questions from before, and just to see if you can get them right this time. So again, what is the lifetime risk of developing schizophrenia? Is it 1%, 5%, 10%, or 0.5%? And that, of course, is 1%. What is the average age of onset of schizophrenia? Is it 15, 70, 25, or 40? And again, that's 25. And to finish, which of the following best reflects the sex ratio of schizophrenia? Disease is equally as likely to affect men as women, the incidence is higher in women, or the incidence is higher in men. And that one is higher in men.